People's Community Clinic is a great place. We're focused on improving the health of the patients that we serve. And a key fundamental part of the clinic is treating patients with respect and dignity. The folks that are here are committed to that mission, and most have been here for a long time. Our provider staff, our physicians, our nurse practitioners, our physician assistants, most have been here for a number of years. We've had people who are here for 15 years. Some of our newest staff members have been here for 4, 5, 6 years.
The clinic was founded by a group of volunteer doctors, nurses, and social workers who saw a need in 1970 and just went about and tried to find a solution. They were able to find a location on the drag in the basement of the Congregational Church, and that's where we started, that's where our roots are, and we've grown since then to an incredible organization serving 10,000 Central Texans, providing over 30,000 visits a year.
At People's, we really strive to be a medical home for our patients, so we're not just here for small acute problems, but we're really here to take care of their ongoing medical needs. And one of our hopes with that is that we're able to keep people out of the emergency room and out of the hospital, because they can come here and get their ongoing needs taken care of and not wait till they get so sick that they need to be in the emergency room or wind up hospitalized.
In order to control your high cholesterol, mainly recommendation is to increase fiber. Okay, so how do you increase fiber?
Another thing for me about the clinic is that relationships are really important here. So the relationships that the staff have with one another and working with one another, trusting one another, and the relationships that we have with our patients. Sometimes the relationship is with the physician or the nurse practitioner, but sometimes the relationship that the patient has is with somebody else. It can be with the person at the front desk, it can be with the cashier, it can be with the lab person who's drawing their blood, but if they have some connection with somebody here, they tend to be more involved in their care, come back more, and it makes a big difference in terms of promoting their health.
I went to a fair at the Texas Union, and there was 2 staff members from People's Community Clinic that had a table looking for a couple work-study positions, and I applied for the position there. Went away to nursing school for 3 years, got my master's, and came back as a chronic disease program manager, mostly doing diabetes education and case management. As I was going through my education and developing myself as a young professional, I think People's is a great place to continue that journey, because it is very open and it allows you to try out new ideas. People want to try new things, and if it benefits the patient, most of the time everyone's in support of it. It's just a welcoming environment for young people, for new people, for all walks of life. Support from the community is very important. Greater than 50% of our income comes from the support of community members through donations, through foundations, through grants, and everyone's contribution makes a difference.
Our patients pay what they can afford, and they contribute to their care and participate in their care, both by their financial support as well as by being part of the care team. We promote a self-care concept that adds to the value and helps improve the health of all of our patients.
Bueno.
People's Community Clinic relies on the support of our community day in and day out, because without the generosity of our neighbors, so many of the people who call People's their medical home would have nowhere else to go.